Hello and welcome to episode 12 of the Equity Plus podcast from CareShare Health Alliance, where we take a deeper dive into issues surrounding health equity. I'm your host, Erin Story, Director of Communications here at CareShare. In today's episode, we'll hear from Rebecca Cerese, Policy Advocate at the NC Justice Center, who's going to share some information about medical debt in the U.S. and North Carolina, and what you can do to get help if you have medical debt. So without further ado, let's hear from Rebecca. First, can you tell us about the NC Justice Center and what work you do?
The North Carolina Justice Center is a statewide not-for-profit whose mission is to eliminate poverty. So no big thing. We just decided to tackle a small issue. And we do that basically by looking at the policy areas that keep people and families trapped in the cycle of poverty. And we attempt to do advocacy work, litigation work, lobbying around those issues. So our areas besides health are education, housing and consumer, workers' rights, immigrant rights, fair chance, criminal justice reform. So it's just across the board. We're trying to do work on issues that keep people and families trapped in the cycle of poverty in North Carolina. Like I mentioned, we actually use several strategies, communications, advocacy, engagement, policy analysis, and lobbying to sort of do it. So it's a very multi-tiered, multi-strategy approach to trying to, ensure that all North Carolinians have what they need to live their best lives.
So it sounds like the NC Justice Center is doing a lot of really important and great work. Can you tell me what got you interested in working in health policy?
So I came onto the Health Advocacy Project about 6 years ago. I am really passionate about healthcare policy. Right around the time the ACA was being talked about, well, a little before that, my mom was diagnosed with breast cancer and she did not have insurance. So we had to navigate that system together. It was absolutely horrible. She got great care by the providers that looked after her. But, we were at UNC, and even when she was going through her chemotherapy, they were bothering her about how she was going to pay her bill. It was horrific. She had to work because, she doesn't have a lot of money all through her chemo. So she would come home from chemo after a really tough day, and there would be like bills stacked in her mailbox, threatening to put her into collections, like all of this. So instead, this poor woman who should have been focused on dealing with a very scary diagnosis and healing had this added stressor of, how am I going to pay for this? Oh my goodness, my credit's going to be wrecked, and all these other unnecessary stressors and worries on top of that. It was a wake-up call for me. It really made me take a second look at our healthcare system, because before that it was like, I have my health coverage, my mom just wasn't covered. It just wasn't anything I thought about. But then when I started digging into it and I realized that we were the only developed country that did not have some sort of universal healthcare system for its people, I ended up becoming a really passionate advocate for universal healthcare in general, but then different ways we can improve our current system as we're pushing towards a saner, less complicated, more just, more equitable healthcare system that has people at the center and not profit.
Yeah, well, I'm really sorry to hear that your mom went through that, especially without health insurance, and then having to, on top of that, worry about bills. I know that was a huge added stressor for her. Hopefully she's doing better now.
She is. She's a breast cancer survivor. We ended up getting her assistance, charity care or financial assistance. I don't want to use charity care. We ended up getting her financial assistance through the hospital. But again, they did not offer that. And this is one of the things I'm sure we're going to get into in this conversation, is that people just don't know what the options are. And unfortunately, although not-for-profit hospitals in this state are required to actually offer financial assistance, many of them do, but don't tell people about it. And so a lot of people don't even know that that's something that they can ask for, and that there's also assistance in filling out the application with groups like dollarfor.org. So DOLLARFOR.org. And I'll talk more about that later. But Yeah, that people just don't know that there's these options. And that's one of the reasons why I'm excited to talk with you today, so that we can really try and get some of these resources out there for people so that people can become better advocates for themselves. Because going into these systems, the best thing you can do is be a strong advocate for yourself and your loved ones, because otherwise these systems will try to get over on you every way they can.
So you've kind of given us an introduction to it, especially on a personal level. Can we talk now about what medical debt looks like across the country and particularly in North Carolina?
Medical debt is a absolutely gigantic problem in our country and in our state. It really is kind of unbelievable. We are the only developed country that allows people to go broke because they got sick or have an accident. We have too many GoFundMe campaigns around raising money for either procedures before they happen or medical bills after they've happened. We just have a giant problem. Healthcare costs are super expensive. Unfortunately, even people that have insurance are often what we call underinsured and are left paying out of pocket costs that they can't afford, which just all leads to more and more bills. Kaiser Health News came out with a study a couple years back that said about 100 million Americans were facing some sort of medical debt, if you can believe that, which is just an absolutely bonkers thought. You know, in North Carolina, it's 1 out of 5 North Carolinians are facing some sort of medical debt in collections. Still, throughout our country, it's the number one reason for personal bankruptcies. And often, many of these folks actually have insurance or had insurance when things started. So, overall, our healthcare system in general, our health insurance system, quote unquote, how we pay for health coverage is not working the way it needs to if we're leaving this many people with bills that they can't afford. The Urban Institute has a really fantastic interactive map that you can go in and look at medical debt rates per, the whole country, per state, per county. So nationally, they have 26% of the country. In North Carolina, we have 33% of our people that are facing some sort of medical debt. Nationally, for white communities, it's 22%. In North Carolina, it is 28%. And then, of course, as we unfortunately know, there is the impact of racism and racial inequities. And nationally, the number is a staggering 35% for communities of color. And even more staggering, in North Carolina, it's up at 44%. There's also disproportionate impact on people who are living in rural areas, and we know a lot of our state is rural. And so you have, very high rates of medical debt in rural areas, but also in urban areas as well. It's an across the board problem in North Carolina across demographics. Really, the only folks that are not facing the medical debt are folks that are very well off, which, is not many of us. And so it's a very big, widespread problem that we definitely need to address.
Absolutely. And just to add, from the Urban Institute map that you're referencing, I believe that it said out of the top 100 counties for medical debt, we had about 12 of them, and 3 of those had greater than 40% of people with medical debt in collections.
It's absolutely huge. North Carolina has the fourth highest percentage of people with medical debt and collections amongst all states. And then, like you said, we have too many counties that have upwards of 40% of folks who are facing some sort of medical debt. Our state also has the 20th highest hospital prices in the country, while our wages rank 40th. So definitely a big disparity there as well in terms of cost and in terms of what people are actually earning for wages. So again, a big issue there.
Clearly, it's a huge issue, like you said, and especially in North Carolina. What are the consequences of having medical debt for people? Like, what does it prevent them from being able to do?
So medical debt impacts people in a lot of different ways. I'll just say, just on a human level, oftentimes if you have any kind of debt and collections, you're getting harassing phone calls from collection agencies pretty constantly. I remember when I was doing my Medicaid expansion work, and one of our storyteller advocates, she had been in the coverage gap, so she had worked up, a huge medical debt. She told me that literally when she would get phone calls, she would almost start having panic attacks because she just knew what was on the other end of the line. And it got to the point where I had to text her before calling her, because if it was a number she didn't recognize, she just would not pick it up. They're kind of relentless about this. Medical debt, they're trying to be better about when they put it on people's credit reports and things like this now. But in the past, it has gone on people's credit reports. And what does that do? So many things now are based on the credit report, even your housing. So sometimes it could, if you have that debt on your credit report, you cannot get a lease for a rental property. It could harm you getting a mortgage if you're at the point where you can actually afford to buy a place. Some jobs check credit reports, so there can be, weirdness there. If you need to buy or lease a car, all these things. And as you can see, we then can go into a weird cycle. I remember another storyteller advocate who I spoke to really early on, was facing like $50,000 in medical debt. And this kept her from doing all of these things. So it ended up being like a cycle. Oh, well, I can't get a car because I have this debt. And therefore, it'll be harder for me to get a job, and things like that. And then, of course, there's the stress of having this debt that you can't pay. We're brought up to believe that this is our responsibility and that we need to pay what we owe and all of this. But these debts are different than other debts. This isn't like someone went on a shopping spree above what they could afford and, are now owing it. Medical debt often comes from, like we mentioned earlier, a terrible circumstance happening, like either a diagnosis of an illness or a condition, or having an accident that leaves you needing medical care. It's very different type of debt, and therefore I think it really should be looked at differently. In the end, I believe that we should be moving towards a single payer system where debt does not exist in our system, where there's no out-of-pocket costs, that, our system is paid for by progressive taxation, because it's just, again, there's just too many wild cards there, and it's not debt like it is with other things that maybe we're like, I went on a crazy shopping spree and above what I could afford, or that's not it. This is very different type of debt. And sometimes the other piece is, it's possible because of your illness or condition or accident, you haven't been able to work anymore, or there's been huge times where you can't work. And then how are you supposed to pay this money? And then there's interest being charged on this debt, which is another thing. It's like there should be zero interest on medical debt, and you should be able to have a payment plan, if we're going to keep this model, right? Like, there's things that we can do to make it easier for people. And so that's one of the things that we're working on now. As long as we're stuck in this system that is creating medical debt for patients, let's do everything in our power to advocate for solutions that could limit what that debt owed is, and the stress dealing with collection agencies and whatnot that patients have to deal with on top of dealing with their diagnosis.
Right. And another thing I wanted us to touch on too is the fact that having that debt could prevent you from getting care. So, for example, with certain doctors' offices or hospitals, you might be going to get care, but they won't be able to provide that care. They will refuse to provide that care because you owe something to them already.
Right, which is obscene. And then there's the people that won't even go to the doctor because they don't want to add to their medical debt. So that's the other thing. People that have medical debt already, and they're like, oh my gosh, I'm not feeling well, but I'm not going to go to the doctor. I remember when COVID first hit, one of our storyteller advocates, a physician at an FQHC in rural North Carolina, She was telling me about a patient that came to her to their outdoor COVID clinic who had COVID, and his oxygen levels were dangerous, where you need to go to the hospital. But he said, me and my wife already owe so much money. We need to come up with a different, game plan. So she tried to cobble together some sort of way to keep tabs on him, to like make sure he's okay. And how many people, because they're afraid of the bill or know they can't afford it, are not going to get the care they need when they need it? And, just from a fiscal standpoint, the system keeps people from going and getting treatment at the front end of an illness when it will be less money and better outcomes for the patient, and ends up instead pushing them to delay care, when oftentimes not only is it more expensive, but then the outcomes are often significantly worse for the patient. So the whole system and the way we do it is actually not set up to put people's health at the center.
Exactly. No, it isn't. Even if the providers and the medical staff, they want to put the person's health at the center. The example that you gave is just perfect. And I mean, there's not really words to describe how sad that example is, to think that someone has COVID and they were afraid to go to a hospital for it because they couldn't afford it. That's a dystopian. But that did make me think, since you mentioned FQHCs, and I've worked at an FQHC for a long time, so you can't bring them up without me wanting to talk about them. The provider going on to have to provide care that's kind of outside of their scope because, for example, someplace like an FQHC or a free clinic, that's the only place that patients can go if they can't afford other care. And so a lot of times you see with those patients, they're generally like a sicker population. It also puts a certain level of stress on the provider and the care team because there's only so much that a primary care provider can do. They can't provide specialty care even if someone needs it, but they have to do what they can do because they want to take care of their patient. And I mean, you see some really heartbreaking things like that.
Absolutely. And I just don't think this is spoken about enough. Most doctors get into this line of work because they want to heal people. And in the current system as it stands, that is focused on profit and not on actual, like making sure people are well, most of these providers cannot actually give care the way they were trained to. And, it's been called burnout, but now my physician friends and colleagues actually go further and call it moral injury. And what it ends up doing is it really takes a very big toll on the providers, who then end up leaving the profession. I mean, and we have a massive shortage, which is a whole other topic, but we have a massive provider shortage that's just going to get worse. And part of it is because of the way the system is structured. Again, not on a patient-centered model, but on a profit-centered model, which just by itself is going to not be conducive for the provider to give the best care they can that the patient needs, especially if the patient can't afford it.
I think it's probably self-evident from the conversation we've had so far why the Justice Center would make medical debt one of its priorities. But could you also still talk about that a little bit?
So, we have spent the last, I've been here almost 6 years, but it's been the last 10 years at the Justice Center, really working to expand Medicaid in North Carolina. Thankfully, we actually did last year, and it's just been a game changer for hundreds of thousands of North Carolinians that are able to get, in my opinion, the best health insurance coverage we have in North Carolina. No premium, no deductible. Highest copayment is $4. It's comprehensive care that includes hearing, vision, mental health, substance use disorder, dental. It offers rides to the doctor if you don't have transportation. It's just simply the most comprehensive, most affordable health coverage we have out there, which has been amazing. But of course, in the time of pushing for this, like I even mentioned multiple times already, the story kept coming up over and over about people facing medical debt because they didn't have coverage. But then on top of that, the story that rarely gets told is the people that have health insurance and are what I mentioned before are called underinsured people who have these health insurance policies with these high deductible costs or high co-insurance or very high co-payments that then can't afford to use it, or if they do use it, they still end up in debt even if they're insured. Unfortunately, this is, again, a very unique United States problem because of the way we do healthcare. We have health insurance that, most people get their health coverage either through their employer or through the marketplace now, Obamacare. And unfortunately, because most of these insurance companies that are working there are either straight up for-profit or they're not-for-profit that act like for-profit companies. In healthcare, a lot of not-for-profits don't really act like not-for-profits, unfortunately. So you have, these profit-motivated, I'll say that, profit-motivated corporations that are offering these insurance products. And unfortunately, it's not about how can we actually put forward the best policies that cover people the most for the least out-of-pocket cost. If these corporations that are offering us these insurance products, if their main focus is making money, which unfortunately it is, then of course they're going to find more and more ways to shift the out-of-pocket cost to the quote consumer. Now, I know in the healthcare space, we use that term a lot. I personally hate that term because we're not consumers of healthcare for all the reasons we've discussed. In the same way, we're consumers of other things. Oftentimes, we're consumers of healthcare because of an emergency or because something bad has happened. And I think it's an industry term that actually takes the humanity out of us. I know patients can be problematic too because no one wants to think of themselves as being sick or, something like that. But I usually use patients. But for these insurance companies and for these purposes, we are absolutely consumers. So they want to figure out ways to shift more and more of the out-of-pocket cost to the consumer so that they can up their bottom line. In fact, it's a perverse incentive to do so. So even with the limited protections that they put into the ACA, the Affordable Care Act, Obamacare, because of the way the system is set up, with profit being at the center, these insurance products over the years have just gotten worse and worse and basically have been leaving the patients, again, I'll use the term underinsured, so inadequately insured. And all that means is their deductible is so high. And in a lot of cases now, it used to be, I don't know if you remember this, Erin, it used to be that the deductible would only kick in if you were hospitalized. Now it's you need to reach your deductible with everything outside of copays before anything is covered. It's really shifted. And plus now $7,000 can be just a regular deductible for folks. And it's just bonkers. Then you have the copays. Okay. So you can be paying $150 copay to see a specialist. I joke, but not really, that's a pay. That's not a copay. That's a pay. And it's very expensive. And then the other little trick that they've come up with is the coinsurance. So coinsurance is a percentage that the insurance company will pay, and then you have to pay the other percentage of the coinsurance. And so this is actually what they're the plans that I've seen recently. This has really been the shift, because then the money is even more, because they can say, well, we'll cover 50% co-insurance and you're required for the other 50%. So that can end up being just a ton of money. And so we have these very complicated, to everyone out there, if you've ever been on the marketplace, or even if your employer has given you the summary of what your policy is supposed to be, oh my God, I do this for a living and it's difficult for me to really understand all of it. The last time I was on the marketplace, which was this year during open enrollment, I was helping a friend. There's 10 drop-down menus, okay? Under imaging, under mental health, under all these, under emergency care, all of these things. And each one of them had its own little formula for your part of the out-of-pocket cost, okay? It's gotten to be so insane and overly complicated because, unfortunately, these corporations that are focused on profit, we've given them loopholes in ways that they can figure out how to pay less and get the patient that's not only paying the premium to have the policy, but then we're also responsible for all these other things. And then of course you have the folks that are still not covered, that still don't have insurance for whatever reason it is, whether they're not eligible for some reason or whether they can't afford it even with the subsidies or whatnot. And of course, that's going to also lead to medical debt, because if they end up in the emergency room or whatever with a bill that they can't use, or they have a doctor's issue, and even going, like you mentioned, to the wonderful community health centers, the FQHCs, it's like there's still a sliding scale there, and they might not be able to do that. So this is the problem. And this is why we're in medical debt, because the whole system is set up around profit. And we have these for-profit companies, or not-for-profits acting as for-profits, that want to make as much money as possible. And that ends up leaving the patients footing the bill. And that's why we are at where we're at. I mean, I don't know if you've ever seen those memes where it's like number of people in filed bankruptcy in America for health coverage. And it has like the list of the countries. Every other developed country is 0 people, 0. I just want people to really take that in for a second. We're the only country that people can literally go bankrupt because they got sick or had an accident. And we are the richest country in the history of the world. We are not a poor country. This would be a very different conversation if we were having it as a poor country, but that's not the situation we're in. And the fact that any of us are okay with this doesn't sit right with me, because we can do better. We should do better. We're also just, big picture, we spend more than double what the other developed countries spend per person on healthcare. So we are spending tons of money. We're getting a terrible return on our investment. 87 million of our people are either uninsured or underinsured. And not only that, with all the money we spend, we do not get good health outcomes. In some areas, yes. And of course, if you have money and you have like the best insurance that money can buy, yes, the health outcomes are much better. But our life expectancy has gone down the last multiple years, and it's not just because of COVID. Our maternal and infant mortality rates are a disgrace. And then, of course, if you add racial health inequities in there, things are always disproportionately worse for people of color and those communities. So it's not even the fiscally responsible way to be doing healthcare. And that's why my goal is to reframe all of it and to help people, get to a place where a market-based system for healthcare doesn't make sense. Even if you're a full-on capitalist, there are certain things that are a public good where profit should not be at the center, because it's a public good. And in fact, people are the most expensive when they need it the most. So it's like there's actually, and again, there's a perverse financial incentive to deny people care so that the insurance companies can make more money. So healthcare in particular, it just doesn't work with profit. And this is why we're in a situation where we're in, where so many families are facing medical debt. People can't afford the care that they need, even with insurance. And I just want us to get to a place as a country where we can have that talk, and we can have that real talk, and try and take the partisanship and any of this other stuff out of it, because it is not a partisan issue. We're not doing healthcare in a smart way in this country. It's overly complicated, it's overly expensive, and it ends up being a cruel system, because too many people get lost in the cracks and end up dying unnecessarily or suffering unnecessarily. Martin Luther King said, injustice in healthcare is perhaps the most inhumane, because and the part that never gets said, but that is the other part of the quote, is he says, because it often results in death. And this is why this is a different issue than every other issue, because it is a matter of life and death for people.
Just kind of to backtrack to where you're talking about like either getting your insurance through your job or marketplace. So for over 5 years, I was what's called a certified application counselor. They're similar to a navigator, and that is somebody that helps people understand their health coverage options through the marketplace. And I absolutely think that the Affordable Care Act and now what's come from that in North Carolina through Medicaid expansion is one of the best things that's ever happened to people in regards to health coverage, but is the absolute barest minimum. It's almost like people can almost get health coverage with it, the way that plans are now. And so, the marketplace and Medicaid expansion are wonderful and they help a lot of people, get more affordable coverage, but they are constrained by the system that we're in. Maybe Medicaid expansion a little bit less, but it's certainly when it comes to the marketplace is very constrained by the system we're in, the level of assistance that people receive from it.
Absolutely. And again, just to underscore the types of products that are available on the marketplace, they keep getting worse and worse in terms of leaving people underinsured. I would say that the best thing that came out of the ACA, in my opinion, personal opinion, is Medicaid expansion, because for someone who believes in single payer universal health care, Medicaid is actually much closer to what we feel everyone should have: comprehensive coverage for very low out-of-pocket costs at the point of service. So of course we know you still figure out a way to pay for healthcare, right? I mean, it's an expense, but if we can do it through progressive taxation and we can have something like a Medicaid expansion where you're not going to even have a copay higher than $4, and besides what you're paying in taxes, you don't have a bill. I mean, I know in this country, this is like unheard of and we can't even comprehend it, but most every other developed country, you don't have to take your wallet out at the doctor's office. I mean, this is how it goes. And if you do, it's like so minimal that it isn't actually something that's going to like be sticker shock for people. So if we can give everyone comprehensive coverage like that's under Medicaid, with such low out-of-pocket costs, what it also does is it would allow us to move towards a wellness model of healthcare that can be focused on primary care, and that making sure everyone has a provider, and it will lead to a healthier population overall and a more equitable population. Again, this is why I'm always trying to challenge us to think bigger about what we can do in this space and what's worth fighting for in this space, because it is something that is a life and death situation.
So we've talked a lot about the issue of medical debt and how pervasive it is. Can we talk now about what can be done if you do have medical debt?
So as we've talked about, medical debt is obviously a huge issue here in North Carolina. And the good news is there seems to be wide bipartisan support to do something about it in our North Carolina General Assembly. In fact, last year, there was a bill, SB 321, the Medical Debt Deweaponization Act. It passed unanimously out of the Senate. This bill would reform facility fees. It would cap interest rates at 5%, which is still too high as far as I'm concerned. It should be 0. But right now they can charge up to 8% interest. So at least it's a little bit better. And that's the cap. So it's like from 2 to 5%. It would force hospitals to have clear language medical debt mitigation policies, basically letting people know that financial assistance is available, because this is one of the biggest problems, that people don't know that financial assistance is available through hospitals, which, by the way, all not-for-profit hospitals are required by law to offer financial assistance to patients who qualify, and that's just not really even talked about. It would cut down on spousal liability for nursing home debt and hospital debt. If a spouse dies, if a loved one dies, there would be some real concrete steps in there that would offer protections. We were hopeful that maybe we could get it passed in the NC House during this short session. Again, it was introduced as a companion bill in the House, wide bipartisan support, but unfortunately, due to politics and personalities and various other really annoying things, that doesn't seem like it's going to happen. But what that allows us to do, which is really exciting, is to build a real grassroots movement across the state around an issue that is impacting so many people. And then when it comes time for the long session to start in January, we could really push for even a better version of this bill, and has a better chance of passing because the personalities that are now holding it back are going to both be in different places. And so there's a real chance that we can add an expansion of financial assistance back in there. That was actually in the original bill, it was taken out. We can potentially look into ways that we can forgive some sorts of medical debt, right, for people who have income eligibility, if we're able to come up with a really good eligibility criteria. We could do something about these medical credit cards. So a lot of exciting opportunities there to really build up and activate people who across the state are facing this issue. Like we talked about, 1 in 5 North Carolinians is facing some sort of medical debt in collections. I have an outstanding medical debt right now. I went to an urgent care, and it was an in-network urgent care, but I had the nerve to ask to get a lab test, and the lab was out of network, and it was a simple test. And they want to charge me $569 for this test. This is just happening. I'm about to start an appeal process now. It's absolutely infuriating. So I'm now one of those 1 in 5 that is facing some sort of medical debt. So it could happen like that. I'm just saying, an urgent care, in-network urgent care, out-of-network lab. How was I supposed to know that? There was no documentation about that. So this is just something that can happen to any of us at any time, even over something really small. So what are we going to do about it? One of the things that I'm really excited about is we are putting together a curriculum and a resource sheet to offer tips and best practices for how to protect yourself and advocate for yourself when it comes to medical bills and medical debt. And we're hoping to really get this curriculum out there, train people who want to give this presentation, and really just try to disseminate it as far and wide as possible. So what kind of things am I talking about? I'm talking about things like, if you get a medical bill, the first thing you should do is actually see if you qualify for financial assistance. So this is one of the things that I'm really excited to tell you about. I found out about this organization. They're a not-for-profit. They're called Dollar4, DOLLARFOR.org. They are amazing, and I want to spread the word to everybody about them. They help people go through the financial aid application and will advocate for people through hospitals about their medical bill. They're amazing. They remind me of the navigators, right? People that are just there to help people go through these really scary, overwhelming applications and processes when it's the last thing you want to be doing, especially if you've been hit by some sort of medical diagnosis or whatever. On their website right now, they have an eligibility tool. You can literally go in, put in your state, the hospital, the amount of the bill, what you make, and they can tell you if you're eligible just like that. Then they have digitized all of the financial aid applications for all the hospitals. It's amazing. They are really amazing people. And I just want everyone to know that this is a resource. They do not have to go through this alone. So some of the things that they talked to me about when I spoke with them is try not to put something on a credit card, even a medical credit card. So the thing about medical credit cards is they have a deferred interest scheme. And so what that means is sometimes they'll defer the interest for 3 months, 6 months, a year, and you can pay it off or, try to pay it off. But if you don't pay off your debt, then it resorts back to interest, usually at a very high rate, over 20, 25%. And it's on the original amount, even if you've paid down a good chunk of that debt. So this is why it's not a good idea to do it. Instead, you can try and set up a payment plan with the hospital to pay it if you're not eligible for financial assistance. The other thing that I thought was that if you have a credit card, if you take out a credit card and pay off that debt, what I was afraid of was that you would not be eligible to have that debt forgiven with financial assistance. So what I found out was that actually it is possible to still actually get a refund of that amount. But again, it's a difficult process, but this is something that organization Dollar4 is willing to work with people on. And so I want to make sure that people know that too. So even if you did take out the credit card and make it into a consumer debt, there's still an opportunity within a certain amount of time for you to possibly still do the financial assistance. And by the way, I did not know this either. You have 240 days to file for financial assistance from the first day you get the bill. 240 days. So this is not like a missed opportunity, right? Like if you've missed out on, a month or two, you can still actually do that. So these are things that, look, I do this for a living and I didn't know. And so I want to make sure that people across our beautiful state understand what their rights are, what they can do. Another thing is one of the first things that you should do when you call up is also ask for an itemized bill. This is another issue. A lot of times they'll charge you for stuff you didn't have done. They will make mistakes because we all know how complicated our healthcare system is, right? So ask for an itemized bill. Then if there's things on there that you want to fight against, like say, I did not have that service, or this is an exorbitant number for amount to pay for an aspirin, for example, or something like that, you can challenge those. The other thing that you can do is you can actually ask for like a settlement fee, which is basically like, well, I have some cash right now. What is the minimum you will take to settle this bill? And then sometimes they can, depending on who you get on the phone, they can tell you a different amount. And that's the other thing. If you don't like the amount, you can always call back the next day and try and get someone new. And hopefully you'll share with your listeners, the founder of Dollar4, Jared, did a really cool video with NPR that sort of walks you through some of this process. And they even do a role play where he calls up and he's like, and he sort of goes through this whole process and sort of talks all about it. So you can sort of get comfortable with that. And I just want to say, like, none of this is right or fair, that so much of the responsibility falls on the patient that's already going through some sort of medical diagnosis or some sort of accident or their loved one, and that we have to take our valuable time to do this. But unfortunately, that's the system we're in. And so the more we know and understand on how to protect ourselves and our families, the better off we'll be.
Thank you so much, Rebecca, for coming on to talk to us today and for sharing all that great information, particularly about what resources are out there for individuals with medical debt. Let's say somebody is listening to this episode and they really want to help in some way. What opportunities do they have to get involved?
We just came off this successful Medicaid expansion fight, and I just want to say that personal stories were a really powerful tool that we had in putting a human face on the issue and changing hearts and minds of the general public and the legislature. As we've talked about, this is not a unique situation. Anyone facing medical debt is not alone. Unfortunately, it's a systemic problem. It's not an individual problem. So one of the things that we're looking for as we're gearing up this huge fight to really push for real protections next year is we're looking for people that are willing to share their stories about how medical debt has impacted them and their families. So, please, if you have a story, contact me. My email is Rebecca, REBECCA @ncjustice.org. And email me to let me know what your story is. We can work together to make sure that you feel protected and supported through telling this story. I'll give you trainings on sort of how to tell your story in a way that protects you. And it really, really makes a difference in changing hearts and minds. So please consider sharing your story and becoming part of this fight for medical debt protections. And thank you, Erin, for giving me this opportunity to talk about healthcare. It's my favorite thing to do because I just feel really passionate that we can do better. I believe that our state and our country can do better than what we're doing now. We can have a more fiscally responsible healthcare system that puts health and the patients at the center. And this is a step towards that.
Thank you for listening to today's episode of the Equity Plus podcast. And of course, special thanks to Rebecca for sharing her expertise with us. You can find out more about Rebecca and the NC Justice Center by visiting their website at ncjustice.org. And you can also check out the show notes for all the resources mentioned today at caresharehealth.org/podcast. If you enjoyed today's episode, don't forget to subscribe to hear more from community leaders and community-based organizations in North Carolina about how they're working to make a difference in health equity. To learn more about CareShare Health Alliance, visit us at caresharehealth.org, and don't forget to check out our hub for community-based organizations working to promote health equity and community voice, the Equity Plus Network, at equitypn.org. That is EQUITYPN.org. We can't wait to connect with you there.